So again, want to stretch that skin and really get at the base. And let's see how he's doing with this. So this one's a little bit more stubborn, so I'm going to go ahead and probe a little more. Make sure we get underneath there. There we go. How are you doing, Christian?
Doing great.
So tell us the good news. When are you graduating?
Oh, I'm expected to graduate in May.
Yay! Well, we're really happy for you. And so what's your next step?
The next step is hopefully med school.
Yay! Super. What are you wanting to specialize in?
Neurology.
Oh, that's awesome. I know you're going to be amazing at what you do.
Thank you.
It runs in the family, doesn't it?
Yes, grandfather.
Super. Okay, we're going to keep working through here. So if there's any estheticians that are watching, again, you just have to really want to stretch that skin. And the type of Q-tip that I use, it's a cotton tip applicator. I use a sterile one, 6-inch. It has the wooden stick. Don't use, the regular one that you buy in the store because it will bend. It does not have the capacity to withhold the pressure. And so you want to make sure that you use one that it is a wood stick applicator, okay? And just get at the base of that lesion, and they really come up really quickly. So you can see that's already cleaned out. I'm gonna go ahead and move over, and this area is called the glabella area, and I am going to probe 27 gauge needle, 1/2 inch. Stretch at that base, and there we go. You're holding up okay, Christian?
I'm doing great.
Good. Small ones through here. All right, so I'm going to start working on this little area through here so that I can just kind of clean this little section here. Again, I'm gonna stretch that skin, 27 gauge 1/2 inch needle, bevel up in an angle, about a 35-degree angle, and get right in that pore. You don't have to make this huge incision. If you prime and prep that skin, that's just for us, our protocol, that's very vital. My philosophy is less trauma is much better for the skin. We don't have to deal so much with the secondary condition of a post-inflammatory problem. So priming and prepping that skin is just essential. And that would be with a wash. We use a glycolic wash to prime and prep that skin. Make sure you guys can see this. It's a little cluster. Okay, so what I'm doing is really making sure that in between those clusters, there's little tiny ones, and so I want to go ahead and get those too. To the naked eye, you can't see it hardly, but I have these amazing glasses that are magnified, and so I'm able to see. Another thing that I always like to tell the esthetician is to really make sure that you cut your nails straight at the base. That word base, sorry, makes me want to laugh. But of your nail, because you don't want to leave nail marks on your clients. And of course, always wear, your gloves to protect yourself. I'm gonna work around the brow area. This could be a little area that's a little sensitive. These are really ready to come out. Another thing, just just for the esthetician and for someone that is wanting to do extractions on themselves, or just make sure that you take the time to open them. You don't have so much pressure on that skin. They'll come out. Just make sure that you do take that time to open them. You'll love your work for it, and your patient will love you for it. And of course, make sure that you switch out your cotton tip applicators so that they're not soiled, because if they're soiled, they're going to slip. Almost done with this area here on the forehead. I'd like to thank everyone for joining us and for subscribing to my channel, and just appreciate your support, really do. We're going to record again. He's going to come back in tomorrow, and we're going to do another section for you guys to view. Hope you have a wonderful and amazing day today. Be safe, and if you have not looked me up on Facebook, I'm really trying to grow my Facebook page. So if you can, and if you don't mind doing me that favor, please go to my Facebook page and hit like, share our videos with the other viewers. Appreciate it, and have a blessed day. Love you guys. Work on her skin, and as you can see, she's very clogged. So she's been on our skincare regimen for almost like 2 weeks now. Is that correct, Smiley? Mm-hmm. Okay. So what we're gonna do now is start doing extractions and clean out those pores. And once we start doing that, she should start seeing a big difference pretty soon. So we really talked about the type of acne that she has, and this type of acne takes a little bit longer to manage just because it's very deep inside the pores, but doesn't mean that we can't manage it for her. So the most important thing, it's called maceration arrest acne. The most important thing is that she really keeps up with her home care regimen. Try not to use too many products so her pores won't get filled. You're gonna feel this just a little bit, but I'll walk you through it, okay? How are you holding up?
It's hard, but it's okay.
It's okay? Right. So as everyone can see, it's really deep in there, and even though I opened them, but she'll get used to it. The first time, I think everyone that comes in here gets their treatment done the first time. It's always the hardest because their body just doesn't know what's going on and it's on alert. But after that, most people sleep right through it. And I'm gonna go ahead and continue to wash her skin just to open up those pores for her. How are you holding up, Smiley?
I'm okay.
Okay. And you can see this is just a very small area that I'm working on, and you can see how much impactions are in there.
So what do you think that caused it? Like, was it most likely the foundations and stuff?
Yes, I think a lot of it has to do with products that you apply it on your skin, concealers, foundation, definitely. Yeah, and you can see even through here you're clogged, you know. So a lot of times with this type of acne, it's more product induced than anything else. Right now we have her just on our basic skincare on the 5%, just step number 1, and then we have her on the BHA solution, and then just a lightweight moisturizer, which is step number 3. And I told her just to stop using anything else, even makeup for now, till we can get her back on track. And our goal really is for her not to have to wear makeup.
Mm-hmm.
You want to get right at that base, and that's so it releases. And you can still see right in there, it's still impacted. So I'm going to go ahead and go back and just open up a little bit more. And you can see it's coming out. I'm going to go in a different angle, stretch, and I'm going to go towards the side and see if that releases. If it doesn't, I'm going to move on. I'll go back and rewash it because I don't want to put too much pressure there. And here we go. stretch again. And again, you can see where the area, you can see where it's all impacted. So I'm going to go back and open that up for her. Smiley, I'm really excited for you because your skin's gonna look super once we get through with it.
I'm glad.
Me too. How was your drive over here?
It was fine. My parents came this time, but they went to go do something else.
Oh, that's nice. Traffic wasn't too bad.
No.
So, show you this so that you have an idea. You could see already how we've cleaned, and just this part alone, how smooth it looks compared to the other one that we started the same way. So you could see there's some pressure, right, Smiley? Oh, you're gonna wear your name really nice. Once we get through, you're really gonna smile, okay? So I think what I'm gonna do with Smiley is that I'm gonna apply a chemical application, and you probably guys have never seen me do that before. A light chemical peel to help expedite some of this to go up to the surface. Because one of the main things with me is that I really don't like any of my patients to be real uncomfortable where they don't want to come and see me. And so she says it doesn't hurt, it's a little bit uncomfortable, but it's her first time. So once she starts coming on a regular basis, it'll be so much different, okay? Of course, she's got a nice one here that we're gonna open that one up for her. When did this one come up? Okay, this will stretch out, and then we go in, okay? And you can see it. Yeah. Again, I'm going to go this will stretch out at the base, and then go in. And you can see it's coming out. Okay. Again, a different direction. Stretch out. And then scoop all the way from the bottom. And you can see it's coming out. And I'm just kind of moving the content so it comes out completely. Now I'm going to go ahead and work on her chin area and see how well you do there, okay? Again, I'm going to stretch. 35-degree angle. I'm hoping that you guys can hear me well. We're all wearing our masks, so except for, of course, the patient. I want to thank you guys. We hit, now we're past 600,000 Thank you so much. You guys are so awesome. I truly appreciate that. I really try to, I've had people, why don't you open it up a little bit more? In some cases I will. I'm about less trauma. And the more you wash, the more the content comes up to the surface of the skin. Just going back over that area. For the ones that are watching the first time, I use a hypodermic needle, and then I go up in about a 35-degree angle. Bevel up. And again, I'm going to go over those areas that I think there might be still some content in there. Okay, stretch again. Go in this little cluster here. Again, stretch, and you can still see that it's still filled, so I'm going to go back over it again. And they're pretty deep.
Mm-hmm.
I'm gonna finish up this part. Remember, this is her first time, you guys. So I know that you want a 45-minute video, 2-hour documentary, but Smiley, I don't think you want that either, right? Not yet. So on the first time, I usually don't want to overwork the skin, and also with her, just to make sure that she's also comfortable. So I'm gonna work on the chin, and then we're gonna say goodbye. What do you think, Smiley? Is that good?
That's fine.
Okay. And that way we can keep her on track and have her come back and see us. I don't want her to be scared of us and never come back, and then you'll ask, where's Smiley? Alright, I'm gonna finish up through here. It really is such a pleasure, Smiley, you coming to see us, because you live pretty far. Count it as an honor that you come all the way over here to see us. And a stretch, and then you could see that one there. And go ahead and go right on that base. To thank everyone for joining us today. Like I always say, I appreciate you guys, love you guys. Please stay safe. You know, keep your distance, keep your masks on. If some states don't have where you have to have it mandatory, but just use wisdom, you know. And I look forward to seeing you guys next time. Know that I'm always praying for you guys. And again, Smiley, thank you so much for allowing us to work on your skin. And we look forward to giving you the best results and getting your skin cleared out. So you can see such a difference there. And of course you can see a difference from over here, okay? Okay, I'm gonna ice her skin down, you know, just bring that inflammation down. And you know, inflammation can cause post-inflammatory conditions, so we want to definitely make sure that we avoid that. And so I'm just going to ice it, and then I am going to apply lactic on her skin. Nothing really extremely harsh, but enough to keep her skin hydrated and exfoliated at the same time. Okay, so I'm gonna go ahead and just ice her all over. I love these little globes. It feels so good on the skin, don't it? When I was a little girl, I don't know, I was in Puerto Rico, we would have these. Do you remember those little balls that you played? Well, I don't know what you call those anymore, but anyway, it sounds like it to me.
Oh, the sizzle balls. Are you
Is
talking
that what
about
is that what they're called? I don't know. I mean, I loved playing that game when I was little. I have such great memories of my childhood when I was a little girl. Just so enjoyed it. And, anyway, okay, so we've cooled you down, and I'm gonna go ahead and pat dry your skin. And we want to make sure that it's, so this is for the esthetician. So whenever you're applying any type of acid on the skin or chemical application, you want to make sure that that skin is completely dry, so it doesn't neutralize the solution that you're applying to the skin. Okay. And what I like to do is pat it dry really nicely. Okay. All right. Okay. So now what I'm going to do is use that solution on the skin and on and off in 1 minute as per protocol. And that's going to be our protocol. Different manufacturers have different protocols. We just do here 1 minute on and off. How does that feel?
Fine.
Okay, good. So from the beginning, and you can see that I'm just kind of doing it in sections like this. So from beginning to end, that should be 1 minute. And then now again, I'm going to neutralize it with water. It almost smells to me like I don't know, like honey or clogging through here. And so that's what I'm going to be working on today. And here we go. It's okay, are you doing pretty good?
Fantastic, actually.
Oh, wow. So I heard that you had a birthday, which was, what date was it?
That was August 1st.
August 1st. Wow. Happy belated birthday.
Thank you.
We're under a heat wave here in Texas, but it's so pretty outside, you know. I guess it's great because I'm in an air-conditioned office and I have this amazing window I can see outside, and so I really don't feel the heat because I'm here all day. By the time it's evening, it's dropped significantly. Okay, stretch. So when do you start school, Kay?
I think it's the 17th for us.
And I guess you're gonna go more of online.
Yeah, we're gonna do the online stuff.
Looking forward to it.
No? I've enjoyed summer.
Oh. Well, it's hard when I think it's mandatory for us here. We have to, the first 3 weeks. Am I correct? It's virtual and then, or, online?
No, I think you just go to public right away.
Oh, really?
Yeah, I think tons of people are doing that one though.
Oh, that I didn't know. So the secret to this, to getting this to clear up is just extractions, and of course him using his home care regimen. For some reason, I thought I heard the lawnmower. So no, not again. They came yesterday, so. So I've had a lot of questions that have come in, and I want to definitely kind of just go over some of the questions. So first of all, he does have blackheads, but he has this condition called maturation arrest acne, and you could see this is it right here. These are like whiteheads, and you could see that they're starting to form into a blackhead. But they're classified like that because it's a non-inflamed, unique type of acne that basically where the face becomes studded with closed comedones, which are your whiteheads, and they don't move ahead from the pore. They just get stuck somewhere in between that and does not mature into a blackhead. Here you can see these matured into a blackhead, but these have not. And so the way to really remove them is to extract them, okay? So just know that it's trapped debris inside that pore, okay? So I've had another question, why maybe he doesn't go into Accutane. First of all, there's this age. There is some risk, and that's a personal decision, and you know, his parents decided to go this route. So even though his sister did Accutane, all the acne came back. So it's not a cure-all. Yes, it could probably, you know, it works on some people, but 85% of the people that take Accutane, you know, have problems where the acne comes back again. So just know that, okay? So I'm glad that Kay is with us, because I really enjoy cleaning his skin, and being able to give him a different alternative than to put him on Accutane. So did you get all that information, Kay, that I just said?
Yeah.
I'm going to give you a test. See if you pass. The best way to manage this is exfoliate, exfoliate, and extract, and extract. The more you exfoliate, and that's like using a glycolic or salicylic type of either wash or solution on the skin, it just moves it forward. And so that's the easiest way to go. So another question that was asked, does these fill up again? They can. So, remember that he has a condition of acne. So what we're going to be doing is really just managing his condition. And if we stay ahead of his breakout, we could do it. So how do we do that? Well, what we want to do is make sure that he comes in, he's still a teen, so he's producing a lot of oils. His family on his mom's side pretty much have, issues with acne. The only one that I'm filming is Kay, but his other sister, we could also film her, but she chose not to have anything done with that. But basically, because it's genetic for them, we have to continuously keep his skin exfoliated, and we could do that. Okay, we could definitely do that. And so I think they'll work out really great. His mom skin looks great now. His aunt, which I also worked on her skin, looks great. So this should also pass, okay, Kay? I kind of laugh because there is one lady that wrote on a comment, and she really wants you to get your skin cleared, But then she's like, oh, but if your skin clears up, then we won't see.
I think I saw that one.
That was funny. I was like, oh. Kay is not ready to fully show his face, but I will tell you, he's a very good-looking young man. And he has some great lashes. I was looking at your sister's lashes today, and it's like, they're not long. I'm like, how did Kay end up with such long lashes? I like to take more of a holistic approach to skincare, if possible. But I know there's times that we have to do, intervention with medication. And, I don't have a problem with that at all. My doctor will definitely talk to him about that and get that going for them. But again, it's a personal choice, and that's something that the family would have to kind of talk about it and see. Alright, as you can see, he's starting to look so much better, smoother. So I'm going to work on this little area here. I've been thinking about my sweet friend Daryl. I remember when he first came in, he was so clogged. And my goodness, his skin looks so good. I miss him. It just takes time. We have to be patient, but we'll get it. Somebody asked, why does some of the pores bleed? It's, sometimes I'll hit, when I'm opening up the pore, I'll hit the outer perimeter where there might be a little vessel, and so sometimes they bleed to that. The other time is that when I get everything out, there's a little bit of blood there, and it's just due to the skin itself. These are very, very small. See how they're bleeding there? It's just where I did the opening. Stretching, getting at that base. And I'm going to stretch again, and at that base. Stretch again, go on that base. Let's go through here. And check. So I've gone through here, and then I'm going to go ahead and work on the lower part of the cheek area. You guys probably seen this one. And I want to make sure I get it out for you. So with these, the ones that have all these bumps, they don't have any bacteria just oil and debris. And so that's why they're not inflamed. And so when they become inflamed, it's because they have bacteria. And bacteria eats away at the lining where the debris is at, and allows the body to heal and becomes inflamed, and you can see it up to the surface. With this, it just stays there and just keeps growing. Okay, I'm going to use, I always kind of dampen these, and I'm going to use this just to double check. So you guys asked why I haven't done Kay's nose. He doesn't have a lot, but Kay, I'm gonna do your nose today, so they believe me. Okay? So I'm gonna do your nose. It's the first time I've done your nose, right?
Yep.
This is not a blackhead, it's a little mole. So here we tend to accumulate some oil, so of course he's got some blackheads here. Such a trooper, because I know it's a little uncomfortable. Or maybe I should have said nothing, huh? I'm having my air conditioner service. There's always something going on at our clinic. So you can see they're just trapped underneath there. And as I start extracting, they'll come up to the surface. I'm gonna go from here. So here's where all that oil gets trapped. You can see he's pretty clogged. Stretch. Base. So you'll see that I go over a little bit of the wash, and then I dry it, because you don't want to have a cotton tip applicator that is wet, because it will not work, or that the skin is it's not completely dry. It'll slip, and you don't want that. I told him to come back so we could kind of clean up what was kind of left over. He said that the one that, if you look at the other video, it was kind of big here, and he said that it just popped on its own, which is great. That means that the acid it worked really nicely to kind of open up that area. I am going to go back and go over it and see if there's anything else in there. How are you doing, Draven?
I'm doing all right.
All right. Well, we like to hear that.